Hello, so today's module we're going to talk about the facial bones. So this is our skull. So far we have covered the cranial bones. So everything, the cranium is what encases the brain. And then obviously we have our facial bones that make up the rest of our skull. In your book, we're going to start the facial bones on page 107. So again, that's your human bone manual. And these should be, I think this is all chapter 7. Pardon me. So the human bone manual does have the ethmoid bone that we talked about in the cranium as part of the facial, but I split it up differently, and that's fine. So if you look on your term sheet here, so these should all be, the term sheet you should have in your course materials. I'll also upload it again here in this module so that you have it in case you need it. We do have a sheet with the facial bones. We should be able to get through this in one lecture because even though there are a lot of facial bones, many of them are so small that pretty much you just need to know they exist. We're not going to dive really deeply into those bones because they're so small and they're going to be difficult to find for you guys. And even if we were sitting in a class, they're really hard to find these bones. So a few of them are very small, so I'm just going to go over those first. So on page 107, also in your term sheet, we have bones called the palatines or palatines. So you can see in the photo, the little drawing there that it's shaded in. There are two of them, a left and a right. They are located up here, right here. Okay, so this is the palate, your mouth palate. So it's the roof of your mouth, okay? So you have a bone on your left and right side of your roof of your mouth. And those are your palatine or palatine bones, okay? So again, you just need to know that those exist, that they are the roof of your mouth. You have a few other bones. Let's see, what, vomer. Okay, and the book does it in that order too. So your vomer will be found on page 109. And again, it's a really small bone. So you can see in the diagram generally where it is. It's going to sit right at the back of your throat behind those palate bones. So I'm going to point to it here. You see this? That's your vomer. Okay? I'll show you guys that again. Okay? So these are your palate bones, right? And there's one on each side. And then your vomer is going to sit behind it. It's a very small little bone right at the back of your throat. And you'll see on page 110, it's that sort of just thin strip of bone. Just a little note, I did put it in the announcements. If you guys are having trouble getting the textbook or it's delayed, certainly Google the Human Bone Manual and the chapter that we're working on, chapter 7. People have uploaded them online. Like everything, you can get it online. I do strongly recommend you have a physical copy of the book. Because, and I did say this in the announcements, our brains learn in different ways. So while I'm showing you these things and we're discussing them, that's one way of learning. Having a physical copy of the book is another way of learning. So just reinforces that information in your brain in a more tactile way, that you have something to touch and feel. So I do absolutely suggest that you guys still get that book. But if it's delayed for you for whatever reason, you can find this information online. Okay. And on page 111, our internal or our inferior nasal conchae, which is a really weird word, right? And you can see from the diagram that those are going to be some bones inside the nose. Okay, see how there's some bones inside the nose. Okay, so inferior means it's going to be these ones lower, inferior nasal conchae. Okay. Your book does the ethmoid bone next. I did that in the cranium. Our lacrimals. Okay, so our lacrimals, if you read the book, it says the lacrimals make up part of the medial walls of the orbit anterior to the ethmoid. What does that mean? So let's break that down because we do see it in a picture, but let's visualize with those anatomic terms. This is good practice with those anatomic terms. Okay, they make up the medial walls of the orbits. So when they're talking about orbits, they're talking about your eye orbits, okay? So medial means it's closest to the midline, okay? So let's go this way. Closest to the midline. So we know our midline divides our down the center, okay? So it's going to make up the medial orbit, okay? Does that make sense? So here's our eye orbit, right? And it's going to be the medial, so the most or the closest to the midline portion of that eye orbit, okay? So right here, those are going to be the lacrimals. And that's kind of where your tear ducts are. So those are your lacrimals. Okay, so again, this is the second sentence on page 113. So let's break down those terms again. The lacrimals make up part of the medial walls of the eye orbits. So they're part of the medial walls of the eye orbits. I think we covered that. Anterior to the ethmoid. What does anterior mean? In front, right? Front. So they sit in front of, they sit in front of the ethmoid bone, which is really, really difficult because we're really only going to see that when we look internally. So think about that, okay? We know these terms. Lacrimals are medial in the eye orbit, so closest to the midline, and they sit anterior or in front of the ethmoid bone, okay? I'm not going to go through the rest of that, but I think that gives you guys a good image as to where they sit. Your nasal bones are just that. They're kind of up. You can see. So if these were the inferior nasal conchae, the nasal bones are going to be up here, okay, the more superior parts, okay? And you can see that on page 114, okay, the nasal bones. So, what are you responsible for? That those bones exist. Okay? They're really, really, really teeny tiny. Like each one individually is so tiny and fragile that even if we were sitting with a human skeleton in front of us, they're so hard to maintain. They're really fragile, so we don't even have those to show you kind of outside of the skull. So, those bones exist. That's what you're responsible for. And a general placement of where they are in the skull. Okay, so facial bones. Let's talk about, I know your book does the zygomatic next, but I want to talk about, and it does the sphenoid bone with the facial bones, but I do that with the cranium. Okay, let me find the maxilla. I want to do that next. So let me just find out what page our maxilla is on. Maxilla is on page 104. So you definitely will be responsible for some landmarks on this. Your maxilla, if you're looking at your book, okay? Whoop. Right here, okay? Can you see that? Your maxilla makes up the top portion of your jaw, okay? So all of your upper teeth, okay, up into some of your nose, all of this area here is your maxilla, okay? And your book has some beautiful, beautiful photos of that. So we're looking at our skeleton, okay? This is our maxilla, So your maxilla actually is divided into right and left portions, okay? So you do have a suture there. We can see that on the bottom too, okay? So it is divided into right and left portions, okay? And again, all of these facial and cranial sutures are important because as we move through the birth canal, we do need our head to be flexible, okay? So your frontal process. Let me see, where is that on your, do you have a photo of that? Your frontal process. Okay. So in your photos, if you look at the very first picture right there in your top left corner, you'll see the frontal process. It's this, maybe if I turn it sideways, yes. It's this area of the maxilla that moves up towards the nose. And it might be difficult for you guys to see. Oh, yep, that's better. There's a tiny little suture right there. So you can see that line. That's the top of the frontal process, okay? So it moves right up into here, okay? And you guys are in the comfort of your own home. I mean, I definitely do recommend, as we're going through the lecture, actually touching those things so it's another way that your brain makes a connection to the material. Okay, your zygomatic process. Okay, so the next one we're going to cover is the zygomatic, which is here. So a process is something that sticks out, right? So this part here of your cheek sticks out and connects with the zygomatic bone. This is your zygomatic process. And you do have a great picture of that here in your book in that same diagram, that top left. So your zygomatic process, okay? It's on the maxillary bone, and it connects to the zygomatic, that process that sticks out. It's the zygomatic process. Palatine process. So again, we're going to flip over our skull. So we know we have those two palate bones. So your palatine process is going to be what sticks out and connects to the palatine bones, okay? So that makes sense. We've got two processes. We've got a zygomatic process and a palatine process. Each of those processes are reaching out to the bone that they're connected to. So one is reaching out to the zygomatic, your zygomatic process. One is reaching out to the palatine, your palatine process. Infraorbital foramen. Okay, so let's break that down. Infra means below. So we talked about the term superior and inferior. So oftentimes when we talk superior, we'll actually see superior as the term. When we talk about inferior, oftentimes it's shortened to infra. Okay, so infra and inferior are the same. So infra means below. Orbital, when we use the term orbital, we're talking about our eye socket or our eye orbit. Foramen means hole. So we're looking for a hole below the eye orbit. Do you guys see those? I'm not even going to point to them yet. Okay? Do you guys see those holes below the eye orbit right there? Okay? Our infraorbital foramen. It's a hole below the eye orbit. Okay? So sometimes it just going back to those general anatomic terms is important. If I say infraorbital foramen, infra means below, orbital is your eye orbit, foramen is hole. Let's look for a hole below the eye orbit. Okay, our maxillary sinus. I'm trying to see in your picture. It's medial. So, all right, let's take this guy. So, we've got our sinuses. It's kind of in here. Wait, I'm not doing a great job of pointing. In here. okay? So it's our maxillary sinus. So we've got those inferior nasal conchae, which are the guys that are poking out, right, that are below. And we've got our nasal bones, which are the ones that are poking out that are above, and kind of in between them, where they're connected to the maxilla bone, is your maxillary sinus. Okay, so inside your nose, we've got the inferior nasal conchae, we've got the nasals, and then in between the two of them, on the maxilla, we've got the sinus. Alveoli. The alveoli, okay, if you're looking at your book, the bottom corner here, okay, very clearly pointing to those sockets that your teeth fit into. Let me pull off the mandible. All right, that's going to make it easier. Okay, so the alveoli are those sockets that your teeth fit into. Okay, so that is the maxilla. It's your upper jaw. Let's jump back around to our zygomatics. Page 115, zygomatic. Whoop, there, oh, this way. Zygomatics, page 115, okay? So, your zygomatic bone, oops, I pulled his jaw off. Let me just get that back up. We're going to talk about that next. Okay, so there's this bone right here, okay? And that's as big as it is. I'm doing a little outline, okay? Because this is our process from our temporal bone. This is the process from our maxilla. And then this little bone kind of right here. So if you guys were to touch the apples of your cheeks, right here, okay? So it comes, you know, right in this area. That is your zygomatic bone, okay? So your zygomatic bone doesn't have a lot of landmarks on it except for where it attaches. So it attaches in a couple different places. And you can see if you flip over to page 116. So the frontal process, okay, is going to be where it connects to our frontal bone up here, okay? So that's the protrusion that connects to the frontal process. We have a temporal process, so that's where it's going to connect to the temporal bone. We have a maxillary process where it connects to the maxilla, okay? So think about it kind of like a little triangle. Frontal process, temporal process, maxillary process. Woo. So 1, 2, 3. A little triangle. Frontal, temporal, maxillary. I have the zygomatical facial foramen. It is a really long tongue-twisting word, but what the heck is that? It's zygomatical. Why they added a matico? I don't know. Just for fun. So zygomatical means zygomatic bone, zygomatical, zygomatic bone, facial, it's part of the face, foramen. So if we take all of that very flowery, excessive language, zygomatical facial foramen is a hole on the front of your face, on your zygomatic bone. So let's look right here. Okay. You see that little hole there? Okay. Is this one easier? This one like it might be a little bit easier to see. Okay. There's a little hole. That's your foramen. You guys have a lot of foramen in your face because you have a lot of nerves in your face. So a little nerve comes through there. So that's your zygomatical facial foramen. So just break it down to foramen and the zygomatic. I know, terms, right? All right, and then let's finally do our mandible. So that's your lower jaw. I just popped him off. He's connected by a little spring here. So I'm going to do my best to show you some of this stuff on the mandible. Okay, so your mandible is your lower jaw, right? And that also is divided into a left and right. Okay. Let's see. The corpus. Oh, you know what? Let me find you the page really quick. Sorry. And it's page 122. Corpus. So in our general anatomic terms, we talked about heads and bodies, right? Bodies of the bone, heads, things like that. So corpse is another term for body. So the corpus, or the body of the mandible, is this part right here that I'm holding on to, right? And you've got two sides. So that's the body or the corpus of the mandible, okay? Your corpus. Your mandibular symphysis. Just trying to see if they've got it. I don't know if it's labeled specifically in your book, but we're going to talk about it. Your mandibular symphysis is the suture that would have divided this bone into left and right. Like that metopic suture, it disappears completely in adulthood. So it's another point at which we can age a skeleton. So if that mandibular symphysis isn't fused, we know it's a very young skeleton. The ramus. Okay, so the ramus is going to be this part here. I don't think it's labeled in your book, but tell me if I'm wrong. The ramus is the part of the bone that moves upward, okay? So this is the ramus. You've got your body, or your corpus. You've got your ramus. Mental protuberance. Okay? There's a bump, okay? Right there in the front, and it's called your mental protuberance. Do you see the action that I'm doing? When we're thinking, right? We're using our brain. If I were to draw this in a comic, you would know somebody was thinking, right? Your mental protuberance, okay? So it's right here, your mental protuberance. You also have mental foramen. So on either side of that protuberance, that bump in the front, okay, so here's your protuberance, and there is one of your foramen, okay? Your mental foramen, and on that side too. So fun fact about the mental foramen, you've got a lot of nerves that come out of that foramen into the bottom part of your jaw. So if any of you guys are follow boxing or anything like that, you know that a punch to the jaw can knock somebody out. It's because of all of those nerve endings that are coming out of that foramen, right? So a punch or a strike or a hit right to this area of the jaw can knock somebody unconscious because of those nerve endings. Those are your mental foramen. Your oblique line. Oblique line. Okay, so you've got a nice picture of that on 125. Okay, so we're looking at our skull here. There is a raised line right here, okay, on the side, right at the back of the teeth. That is your oblique line. Coronoid process, mandibular notch, and mandibular condyle all kind of go together. And they're all right here. So hopefully that's not distracting. There we go. So I'm going to pull this out. So those are three landmarks that go right in a row. The first one is your coronoid process. Okay, we know a process is something that protrudes, right? Process. So that is your coronoid process. Okay, and then we have our mandibular notch. Okay, so we see that that's a notch. Coronoid process, mandibular notch, and then our mandibular condyle. And if we remember back to our anatomical terms, condyles are rounded protuberances, right, that connect two bones together. Okay, so this is our actual joint of our jaw. Okay, these three things make up that joint: the coronoid process, the mandibular notch, and the mandibular condyle. So let me pop all of those back into place so you can see how they line up. Okay. All right. So we're going to start anterior. So this is closest to the front, right? Anterior. Just trying to move this the best way. Perfect. I like that view. Anterior. So the most anterior of those three landmarks is your coronoid process. Coronoid process is the most anterior. Then you have your mandibular notch, and then you have your mandibular condyle. Okay, so you see how that connects here into the temporal bone. Okay, so the mandibular condyle is going to be the most posterior. Coronoid process is going to be the most anterior. And I'm just flipping back to my temporal landmarks because this mandibular condyle goes into the mandibular fossa on the temporal bone. Okay, so mandibular condyle goes into the mandibular fossa, and that joint is able to move up and down. All right, guys, that should be it for all of our facial bones. Let me just double check my notes. Yes. Okay. So just one video in this module because we really only covered landmarks on 3 of those bones. Most of them, we just don't have landmarks where we just kind of generally know where they sit in the skull. So that's it for the skull. So you guys have a discussion question and a quiz. So pop over to that when you're done here. And as always, if you guys have any questions, shoot me an email. I do pop into the discussions, and I may every once in a while post a comment in there, but that's much more for you guys to talk to each other and ask each other questions if you have them. So please feel free to utilize that. All right. Have a great day.